A warm welcome to this series of video presentations about the role of biophosphonates in terms of the treatment of Paget's disease of the bone. So my name is Peter Jones. I'm a trustee of the Paget's Association, and we're presenting these videos in celebration of the Paget's Awareness Day on the 11th of January 2021, which was the 207th anniversary of the birth of Sir James Paget. So it's my pleasure today to welcome Mr. Keith Simpson, who has very kindly agreed to talk about his experiences as a patient with Paget's. And Keith, I know you're also a former trustee as well as a patient, so you're well acquainted with the treatment for Paget's. I just wondered if we could just start by talking a little bit about biophosphonates and what you think the benefits of them are to you and other patients.
Fine. Okay. Well, morning, Peter. Yes, I've had treatment with bisphosphonates, and for me, I had complications, but I do think that they worked. Originally, when I was diagnosed in 2012, the consultant at that time decided not to do treatment. But my first set of bisphosphonates was a set of infusions where I had permidronate. Now, and then I had, after that, I had, what did I have then? I had residronate tablets, which were quite complicated. You know, you had to take them with lots of water, you had to stand up, you had to keep vertical for about half an hour. So that was not ideal, to say the least. But then I had a zolidronate infusion. Okay, I had complications, so it wasn't straightforward for me. But being a trustee, and also I was on the team that got the guidelines, clinical guidelines for the treatment of Paget's, and really being on that committee was a heck of a steep learning curve, and you got lots of feedback. But basically, the patients, it was pain. And it seemed to me that bisphosphonates, even though, okay, it's been 50 years since somebody discovered the first bisphosphonate, we're now sort of in around where zolidronate seems to be working, seems to be doing the job, and it lasts longer. It's not just a sort of a one year, 2 year sort of great thing. It goes on for years. Really, I don't think we've got a time scale where we say after 6 years you need some more. It does last quite some time.
What would you say to people who were nervous about having an infusion? Because it's obviously something that people don't have done every day. So,
well, again, you know, we suffer with a lot of pain, and that's debilitating. You've got the pain all the time, and it's not very good. So, okay, you have a discomfort in having an infusion. I mean, I was probably the age of 40 before I could sort of get away from looking at a needle. If somebody showed me a needle, I'd faint. I'm fine now. But infusions, it's not a difficult thing. And people seem to be very concerned about the side effects. And the main side effects that a lot of people take on is the flu-like symptoms. And really, I only had the flu-like symptoms once when I had the first of the 6 infusions of permidronate. I didn't have any side symptoms with zolidronate. In other cases, the pain's gone, and that is the big thing. That is a big thing. But people are so concerned about these side effects, and sorry, I cannot sort of take it on board. A bit of discomfort for a few days is well worth that relief of pain.
And that's a reassuring thing.
Yeah, there doesn't seem to be sort of any other treatments that can match zolidronate.
Indeed, indeed. Well, I think it's the one that does seem to work, and as you point out, there are some side effects, but overall, it's well worth it, isn't it? If it gives you that multiple year protection, as it were, So yeah, well, I wonder, we'll maybe come back to that towards the end again, just to emphasize how it's benefited you personally, as well as observing it in others in your role on the clinical clinical group that you were involved in. But maybe we could just sort of go through your journey, Keith, in a few questions, because I know that with Paget's and osteoarthritis, which is a related condition, these things combine to make your journey a little bit more complicated than others. So could we just briefly go back to the beginning and when you first experienced pain and discomfort, and how it came about that you were diagnosed with Paget's?
Okay, well, probably, we're talking about 12 years ago now, where I used to play a lot of golf. I enjoyed my golf, but I was, after a round of golf, I was having a lot of pain in my knees and legs. I took a bit of persuading to go to the doctors. I went to the doctors, sent me for an X-ray, and yeah, my knees were fine. Nothing wrong with my knees, but I'd got two bad hips, very bad hips, and I'd got possible Paget's disease. And that's when, when somebody sort of says you've got a bone disease called Paget's, I'd never heard of it. And, you sort of, it's panic station, isn't it? It's not.
Yeah. And was that the GP who made that diagnosis?
No, well, yes. When I went to see the GP, she'd got the information back from the X-ray and that, and she said, well, I've never had a Paget's patient before. She said, okay, in my younger days at university, I can recall it being mentioned, but I've never had a Paget's patient. Mm-hmm. One of the other doctors was saying, at my practice, he'd not seen any Paget's patients. So, it's something that the doctors don't see. No. But luckily enough, the radiologist had picked it up on the X-ray that I'd got possible Paget's. They then had to do further blood tests. They did a nuclear bone scan, and from all that information, yes, I've got Paget's in my femur, my right femur. I was back at the doctor saying I'm in lots of pain, and really, can you do something for me? I was in a lot of pain. So again, I went back to the hospital. I saw another consultant, and he sort of said, right, well, we'll give you a nuclear bone scan, see what the Paget's is it active or not? Which they did, and yes, it was active. It had gone further up the femur, so it had spread up the femur, and so he decided to give me these 6 infusions of Residronate. Sorry, Primidronate. So that was 6 infusions of Primidronate. It's just something, it's an infusion, it takes a couple of hours at the hospital, and okay, fine. That's the infusions were okay. The pain didn't go away. In fact, the pain got worse. It was then a phone call to Paget's nurse, Paget's Association nurse. She said, well, 6 weeks. Well, it was 6 to 8 weeks then. She said, well, give it a couple of more weeks, but really don't leave it. Go back to your GP and take it further. Which I did, because of course the pain still wasn't getting any better. It should have been reducing after the bisphosphonate infusions, and it wasn't. So went to see the doctor. She was able to get hold of my consultant at the hospital. He said, well, perhaps you'd better send him in for some X-rays, which, yeah, I did there that afternoon. Hobbled into the hospital with my dad's old walking stick. That's the state I was in. I was struggling walking. Had the X-rays, lots of X-rays. Radiologist said, Mr. Simpson, would you like to come and just have a look at your pictures? He said, we'll put you in a wheelchair first. Which, when somebody sort of says that to you, sort of thinking, hello.
Not a good sign. Yeah.
Not good. He showed me a picture that had been taken 2 years ago where I'd been diagnosed with possible Paget's. He said, that's your femur, which was bent then. He said, when we zoom in and look at the surface, there's all these microfractures on the surface of that femur. He says, now, obviously, one of those has developed And we've now got today's picture, and there was a fracture where there was just a little bit of bone left. He said, so that's your picture today. One of them fractures, obviously, microscopic fractures had opened up to a full fracture. He said, you're not going anywhere today other than down the corridor in the wheelchair to the accident and emergency, which is quite frightening, you know, when you see it. It's a terrible picture. So, okay, I'm down in A&E, saw a surgeon, looked at it, yeah, put him in cotton wool. I want him on a bed, treat him very carefully, gently. I don't want that leg breaking. There's not much bone left. We'll operate tomorrow, you know, and sort of, what? Operate? You know, it was actually 2 days later that they operated. The surgeon was concerned. She had to get a lot of blood in because she said with these operations, with Pagets, you get a lot of blood flow through the bone possibly. And therefore, you know, you can't put a tourniquet on a bone. It can be quite dangerous. So we need to get lots of blood in for you. Anyway, I had the operation. I had a 12-inch plate, something like a 12-inch plate put in, and with 8 large screws, and fine, the operation went well. Didn't have a lot of blood flow. I think that was possibly because I'd had those infusions sort of, you know, a couple of months, 2 or 3 months beforehand. So that possibly had quietened down that Pagets in the leg, which was, yeah, I was lucky on that. But, you know, where they sort of said, well, the fracture should heal 6 or 8 weeks, something like that. So
that operation was dealing with the effect of just the Paget's disease, or were there other links?
No, it was dealing with the fracture.
Because I know that you went on to have some hip operations. They came afterwards, I think.
They did. I couldn't sort of bend down. I couldn't put my shoes on. I couldn't tie my laces. I couldn't put my socks on. If I dropped something, I had to get a stick to retrieve it. And life was very, very, very difficult. And I was in lots of pain. So was the pain from the Pagets in the femur, or was the pain from the hip joint? That was sort of, you know, what was it? I was at a meeting, a Pagets Association meeting in Norwich. And one of the presenters was a surgeon, and talking with him after his presentation, and I told him my story. He said, I do know of a surgeon. Luckily enough, the guy was at Nottingham, where I do go for my Paget's treatment. This guy did the job. He sort of said he'd take leave the plate there, the big 12-inch plate. He'd take these large screws out. He'd put short screws in. If that was successful, he'd continue with the operation and put a large stem new hip in, which he did. It was a 4.5-hour operation, but it was successful. And really, from that day on, after the operation, the day after the operation, I didn't really have any pain. Okay, while I was in hospital, I was still on these serious painkillers. But when I came out of hospital, lots of physio. I was sort of weaned off the patches and tramadol. Yeah, I came off them, and I felt a different man, and I had no pain at all. It was heaven. It really was.
It's a really good ending to a difficult, number of years for you. Well, Keith, thanks for sharing your story with us. I'm sure it's going to help people as they navigate, their own issues with Pagets and other things.